Hi everyone, I'm Erin. Welcome back to my YouTube channel. I'm so happy that you're here. Please don't forget to like and subscribe if you haven't already. And today I'm going to be doing a get ready with me while I tell you why I was in the hospital for 539 days. And I tell you my battle with anti-nmda receptor autoimmune encephalitis. I will list all the makeup products that I'm using in the description below. And I wanted to give a warning that some people may find the pictures and videos that I show in this video uncomfortable. It all started May 26th, 2022. I was a normal 23-year-old girl, and I had just graduated from Elon University in North Carolina in 2021, and I had been working remotely in email marketing, and I had no health concerns. I was living a totally normal life. I was busy at work, and I hadn't drank a lot of water that day, so I developed a headache, which I described it as a lot of pressure in my forehead, and I was a little bit nauseous. I didn't finish my dinner, but I figured it was just dehydration, and I tried to sleep it off, but I woke up Friday, and the sleep didn't really help. I still had a lot of pressure in my forehead, and I was still really nauseous. But I was able to eat a few saltine crackers. I still continued to work remotely, and I tried to take a bath to relieve the pain, but that didn't work. And I didn't feel well because my family wanted to get Jersey Mike's for dinner, and I didn't want it, and I love Jersey Mike's so much. On that Saturday, I woke up really nauseous and shaky and pale, and my headache was worse. I tried eating some plain pasta, and I threw it up. And at that point, I went to urgent care because clearly something was wrong, and they treated me for dehydration. And then they gave me fluid Tylenol and a nausea medication, and they took blood work. And I had low sodium, and my white blood count and platelets were high. And they recommended that I go to the emergency room at that point. So when I was in the emergency room, they did more testing, and they gave me more fluids and a stronger pain medication when I was there. And from doing that, my numbers normalized, but my head was still really bothering me. So they discharged me, and they told me to follow up with my primary care. And in a few days, when I came home, I began being really disoriented. So I started mixing up stories about where I was, and I was forgetting if I was in the emergency room or if I was in urgent care. And we figured that it was just that I was really tired from the long day that I had before, but they said that I should just go to bed and try to sleep it off. And this photo that I'm inserting here was May 28th, 2022 at urgent care. On Sunday, I had a very hard time sleeping. I vomited a few times, and I was really confused. I was answering things saying that the year was 2023, but it was 2022. I kept asking the same questions over and over, even though I had already asked them to people. I went back into the emergency room, and they did a CT of my head and ran some more labs and other tests. My CT showed that I had no clotting or bleeding in my brain, and they also did a chest x-ray and a spinal tap and an MRI of my head. At this point, I also had a fever of 100 degrees Fahrenheit. I tested negative for bacterial meningitis, but they were worried that I had viral meningitis, so they started treating me for that and other things like tick-borne illnesses while the tests were pending. I was then admitted to the hospital, and I continued to be very delirious and agitated and disoriented. I kept trying to rip my IV out, and I wouldn't sleep. And it got so bad that they had my sister come back with me because I had called security and told them to get out of my office. So you could tell that I was not in the right state mentally, and I was very delirious. So on to Monday. On Monday, I continued to get more delirious, and the meds really weren't working. And then I saw an infectious disease doctor, a neurologist, and a regular doctor. I tried drinking a few sips of vanilla milkshake, and I had some water and a few crackers, and later threw it up. I had more blood work, another MRI, a CT scan, and an EEG. And I was transferred via ambulance to Beth Israel Hospital. So on Tuesday, I still wasn't sleeping, and I started doing this funny thing with my tongue because I couldn't manage my saliva. I threw up again, and shortly after that, my oxygen levels dropped really, really low, so they transferred me to the trauma ICU and placed me on a breathing tube in my mouth and put me on a ventilator to prevent me from choking and to help me breathe. On Tuesday, I got another MRI scan, a CT scan, an EEG, and the CT scan was done with a contrast injection to help them see better. It was done on my chest, abdomen, and the pelvis, and this was when they noticed a small cyst on my left ovary. So nothing was abnormal with my MRI, my CT, or my EEG. And on this day, I got some medicine to keep me comfortable with the breathing tube and the antibiotics. On Wednesday, they took more fluid from my spine to test, and they put a feeding tube in my nose, and they transferred me from the trauma ICU to the neurology ICU. And now I'm going to insert a photo from June 1st, 2022. On Thursday, as different tests started coming back negative, they started taking me off different antibiotics, but I was still on a lot of medications, so I had a PICC line inserted. And because they saw the cyst on my left ovary, they did a test for nmda antibodies to see if I had an ovarian teratoma, and this was sent to the Mayo Clinic. I also this day had a fever of 102 degrees. On Friday, I started immunosuppressants medications, and they were high-dose steroids, IVIG, and rituximab. We also had to slow down the immunosuppressant medications because I had a fever of 101 degrees. I also started antibiotics for pneumonia, and then at nighttime I had a seizure, so they started me on seizure medications. And then they did another CT of my head, and everything was fine. There was no bleeding, no swelling, no masses. So I was still on the ventilators, but I was on spontaneous mode is what it's called, because I was still initially breathing on my own, but at this point they put me on propofol to help with sedating and stop seizures. On Sunday, they tried to wean me off the sedation, but I kept having seizures again, so they put me back on it, and on Monday, no improvements were made, and I was still sedated. On Tuesday, my nmda receptor antibody test came back positive, so they diagnosed me with anti-nmda receptor encephalitis, which is an autoimmune encephalitis that's often triggered by an ovarian teratoma. So they laparoscopically removed my entire left ovary. Then on Wednesday, nothing had really changed. Movements were not purposeful, they were involuntary. I was no longer responding to commands or anything. At this point, I was in a coma, and one of my involuntary movements was clenching my jaw so hard to the point that I knocked my front tooth out. So I'm going to insert a video here showing some involuntary movements that I would make. Black, 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 black. Black. So on Thursday, the pathology confirmed that it was a 2-centimeter teratoma made up of neurocells, and it had a little bit of brown hair on it, and it was moving my extremities. I was moving my extremities, but the movements were not purposeful. On Friday, I had a really high fever of 104 degrees, and they did an infectious workup, but it was automatic dysregulation, which is common with encephalitis. My body was having a hard time controlling things like my blood pressure, my heart rate, and temperature. They had to start weaning me off the propofol because it was a fatty liquid and it was making my triglycerides, I think that's how you say it, too high. But once they weaned me off it, I had 3 seizures. So they had to add different anti-seizure and sedation medications to stop them. Then on Saturday, I got another dose of rituximab, and I was on fentanyl for pain management, and at this point they switched me from a breathing tube down my throat to a trach, and they switched my nose feeding tube to a stomach feeding tube, and this was known as a peg tube because this was going to be long term. So at this point, I still had an EEG on monitoring my brain, and they noticed some small seizures on the monitor. From June of 2022 to January of 2023, pretty much every day was spent having neurological episodes with minimal improvement. I won't describe every single day, but I will give highlights of what happened each month. For me, these neurological episodes were losing control of my body. It involved extremely high or low heart rate and blood pressures, involuntary body movements like kicking, punching, and putting myself into weird positions, clenching my jaw and fists to the point where I was cutting myself with my nails, seizures, extremely high or low body temperatures. And how they managed these episodes were by medications, machines like the bear hugger, and cooling pads, and just by riding it out and making sure that I didn't hurt myself in the process. Some of these episodes were so extreme that they had to use medications to paralyze me so that I didn't hurt myself. I was on daily medications for all the side effects of the neurological episodes caused, as well as medications needed to try to improve the episodes as they happened. So in June of 2022, an oral surgeon took out the other one of my front teeth because it was so damaged from the involuntary clenching that I was doing. I also had pneumonia and a kidney infection. And I had a ton of infections over my hospital stay because I was immunocompromised. I had an ultrasound of my legs to make sure that I didn't have any blood clots, and an echo on my heart because of, at one point, my heart rate dropped into the 30s. I also had Botox in my jaw muscle and my salivary glands to help with clenching and involuntary movements and saliva. In July of 2022, I started showing little bits of progress here and there. I would sometimes squeeze people's hands back if they were holding mine, or I would look at people. I also started breathing a little bit on my own and triggering the ventilator on my own. They tried to trial me on a trach collar and an oxygen mask to see how I was without the ventilator, but I didn't breathe well enough on my own. So I stayed on the ventilator, and the neurological episodes were still really bad. Sometimes I would rip my ventilator tubing off, and one episode was so bad that I fought through ketamine, Valium, and propofol. They also did an MRI of my pelvis and noticed a small mass on my right ovary, which they decided to leave it be for right now and check it again in 8 weeks. I also started receiving plasmapheresis treatments, which is where they put a line in my neck and it takes the blood out of my body and runs it through a machine that separates the plasma out of my blood cells and then puts it back in my body. and I got a total of 5 plasmapheresis treatments, and I also needed 1 blood transfusion. In August of 2022, I needed a new PICC line and I got pneumonia again. I had an EKG, an ultrasound of my heart, which was fine. And this is when they had to shave parts of my hair because it was so matted and bad from the EEG glue and just being bad for so long. My neurological episodes were still pretty bad, and some of them still needed a paralytic IV drip to stop them, and I had a PET scan which showed that my brain looked normal. The mass on my ovary hadn't grown, but the pneumonia was getting pretty bad. And in August, I got my first visit from Harry the Healer. He was a dog, and he was super cute. I also had Cytoxin, which is used for anti-nmda receptor encephalitis when first-line treatments and plasmapheresis and IVIG didn't work. In September of 2022, I started to seem more responsive to stimulus like wiping my face. I had an MRI to check if the other ovary was okay, since they were concerned that this was a secondary source as to why I wasn't getting better. They had to do cardiac labs and another EKG because my heart rate dropped super low again, and I had a really funky rhythm to my heart. And there was a point that they thought that I was looking up at people when they were speaking to me. And there was one time where I closed my eyes when a doctor asked me a question, but there still wasn't much improvement. And this is the time that I had my second dose of chemotherapy. In October of 2022, my treatments were another dose of chemotherapy, another round of IVIG, a blood transfusion, a round of bortezomib shots. I'm not sure how to say that. These shots target plasma cells that produce the antibodies. At this point, I would look side to side when people would talk around me and was triggering the ventilator on my own more, and I was still having seizures and neurological episodes. And 2 times I needed a unit of blood, and I also got the bortezomib shot again. But still, they were seeing very little progress in me. Then in December of 2022, I had to have my hair cut off. And the treatments were another round of IVIG, more bortezomib, nebulizer treatments, and more Botox for the clenching of my jaw, and another dose of chemotherapy. I also had another lumbar procedure to send to the Mayo Clinic, and I took antibiotics. I also, based off the EEG, they found that I had 4 episodes of birds, which are short seizures that aren't long enough to be classified as seizures. They are about 5 seconds long, and the concern is that they could turn into real seizures. My heart rate paused for about 5 to 8 seconds, and which they believed was a vagal response. At this point, they decided to go forward with removing my second ovary and fallopian tubes. In January of 2023, my treatments were another round of IVIG and the bortezomib shots, my last dose of chemotherapy, and then Celcept and rituximab. On January 13th, I had the surgery to remove my right ovary and fallopian tubes. Everything was sent to pathology, and then the pathology report came back and said that there was a small cyst but no teratoma. And I made minimal progress, but did start smiling when I heard my dog on FaceTime. In February of 2023, my treatments were IVIG and toxizumab, which is a monoclonal antibody sometimes used to help and treat anti-nmda receptor encephalitis. They started the process of weaning me off the ventilator and some of the daily medications I was on to treat the side effects of the disease, because I was starting to show some progress, and the progress was needing less medications during the neurological episodes and less episodes in general. And my report from the Mayo Clinic on my spine fluid from December came back and showed antibodies were still present. And my family snuck my dog in to see me. So in March of 2023, I was finally off the ventilator, but I still had the trach, and after 287 days in the ICU, I was moved to the neuro intermediate unit. My treatment was rituximab and IVIG, and I was having neurological episodes, but they were less and requiring less medication to manage. They were continuing to wean me off medications, and I had a liver injury, and that was possibly from the IVIG, and my doctor noted that I was slowly starting to come out of the coma. Then in April of 2023, my treatments were rituximab, Botox in my jaw, and a CellCept. I was starting to become more alert, and the episodes were continuing to lessen in frequency, and I was starting to self-resolve them, and the episodes were worse when I was infected. I was starting to laugh and smile more when I saw my dog on FaceTime, and I did start struggling with C. diff infections. C. diff is an overgrowth of bad bacteria in your gut, which causes infection. It is often caused by the antibiotics killing off the good bacteria, giving the bad bacteria a chance to take over. Since I was on a lot of antibiotics, different infections, and am immunocompromised, it is not surprising to the doctors that they are a little bit bummed that I'm not recovering faster, and they aren't going to change the treatment regimen, and I just needed more time, but I was definitely a slow healer. In May of 2022, I started working on breathing more independently, and they started deflating the balloon in my trach cuff, and I regained control of my bodily movements on my own, and I started tracking moving people, and they gave me a spoon and I put it in my mouth on my own. For the rest of 2022, I started making improvements, weaning off medications, and had less episodes. I was more awake and alert, and I was able to have my trach removed in August and started speaking a little bit more. And on November 20th of 2022, I was able to be transferred to a rehab center. I spent November to January of 2023 in the rehab center working on my physical therapy, occupational therapy, and speech. I started having a daily schedule and working on things like getting up and walking, talking, and taking care of myself and brushing my teeth and hair and using the restroom. I was still struggling on some recurring infections and some neurological episodes. The episodes looked a little different because I was more awake and aware, so they were more being confused where I was and getting upset and angry. I also wasn't eating enough, so I was reliant on my feeding tube and was working on and being able to drink and eat enough alone. So I got to the point where even though I still needed the support, the best thing was to leave rehab and go and be home. So on January 9th, 2024, I left the rehab center and moved home. And luckily my sister is a nurse practitioner, and she was able to help manage my medications and feeding tube, and from January to the present day, I have been slowly becoming more independent and have less and less neurological episodes, and the episodes don't really look like high blood pressure and involuntary body movements anymore. They are being confused and angry at having some issues regulating my emotions. I no longer need a feeding tube and can eat and drink enough on my own, and I can do things like cook, clean, and shower. And to this day, I'm still recovering in the present day, but I don't have any neurological episodes anymore. I still struggle mostly with short-term memory loss, and I'm not very good. It has gotten better since I have gotten home, but I still have a lot of room for improvement. I still have symptoms of extreme fatigue and a hard time sleeping, but I know that I will continue to progress and get better. I remember absolutely none of what happened to me, so I'm thankful for my family who took notes for me every single day that I was sick and that I could know everything that I went through. And I want to thank all the people that have helped me along this journey, all of the doctors, nurse practitioners, nurses, respiratory therapists, PCTs, surgeons, PT, OT, speech, everyone that has worked with me throughout being sick and my recovery. I thank you very much. I appreciate all the work that you do with me and helping me get better. It does not go unnoticed, and I'm extremely thankful to have you all in my life. One thing that has definitely not changed for me is my love for makeup and beauty and purses. And when I started to wake up from the coma, the first thing that PT and OT had me play with was makeup and brushes. And you could tell me how happy I was to do that, and I am going to continue to post beauty content and also share my story and talk about my recovery, and I hope that this was helpful. And if you have any questions, please let me know in the comments. I'm so happy that you're here, and thank you for watching.